Anya, if you don't have any question, could you kindly keep yourself muted? Thank you so much. All right, doctors, another 2 to 3 minutes and then we'll begin. Just waiting so that maximum people, maximum doctors can benefit from the session.
अभी तो सेशन हो रहा है
अभी लेंगी
Okay. All right, doctors. Okay. Okay, doctors, before I begin the session, just letting you know, I also conduct Plab 2 course. And I also conduct mocks. Please let me know if you're interested. I can give you more information at the end of the session. I usually run recorded course, which has very, very high passing rate. However, I'm planning to also conduct a live course in coming March, maybe end of February or March. So do let me know if you want more information about that. It will be a very, very interactive course. Even though the recorded course is going really well and everybody loves it and everyone wants to have. So anyone who attends the live course will also benefit from the long recorded course as well. So yeah. All right, doctors. So here we begin. Let's begin our today's station that we are going to cover. Now, I particularly wanted to cover this OSCE station because when I conduct mocks, I have seen that many doctors make mistakes during this station. Also, why I wanted to cover this station is that I noticed that many of you, when you come and do mocks with me, many of you are not able to finish this station within the time limit. I mean, if you don't finish the station, at least if you come to management, that should be all right. But what happens is that many of you are just taking history in this station, and history is ever so lasting. So my motivation, my intention of particularly conducting a session on this OSCE was so that I could actually guide you that in stations like these where history taking is just ever so challenging, what should be your approach and how can you cut down on your history? What are the unimportant things that you can just cut down on? How many differentials you should have, for example? So we'll be talking about all those things, that how concise, how precise your history should be for this kind of stations, okay, where you find or you struggle to finish the station in time. Almost everyone comes across and does this station of lymphadenopathy. They are not able to finish in time. Also, what I have noticed that every single person has a different provisional diagnosis for this kind of station. Someone says, oh, you have lymphadenopathy because you have cancer. Oh, well, Mr. Albert, you have lymphadenopathy because you have sexually transmitted infection. Well, Mr. Albert, you have lymphadenopathy because you have HIV. Okay, so also we'll talk about that what actually should be provisional diagnosis. um, depending upon what findings do you get. Okay, doctors, I will be very, very grateful if you keep yourself muted, especially Dr. Charlie Boy 2022. Can you kindly keep yourself muted? Thank you so much. I promise I will let you guys ask questions at the end of the session. So if you stay patient, keep yourself muted so that everyone can hear me clearly. All right, doctors. Lovely. So without wasting any further time, let's go ahead. All right, doctors. Now, the patient is a young patient presenting with lymphadenopathy. Okay. Patient is young. So now you should, when you are standing outside reading the task statement. Now, um, even during the course when I teach, I can't emphasize enough that I always tell doctors that please, that 1 minute, 1.5 minute that you get before you enter the cubicle, it is very, very crucial. Now, if you think that someone has actually told you, for example, today I have told you that that 1 minute is very, very crucial, and you will start using it, you will think, oh, well, I will keep preparing, I'll keep revising, but I will train my brain of using that 1 minute in the exam. Trust me, my dear, you're not going to succeed that way. Now, all these exams are, they have made them not only challenging from the point of view of knowledge, but also at this level, the exams are challenging because of the timing. The time is very, very limited. Now, they are assessing you that how smartly you can use those 8 minutes, how smartly you can use that 1 minute provided to you. Okay. So while you're standing outside the cubicle, your job should be to analyze the station, analyze the task statement. Okay. Now, these days, over the time from 2020, 2019, what they are trying to do is that they are actually making the task statement very short. So it's becoming even more challenging to, have a prepared plan. But I would still say that still have a plan, still use that 1 minute for your plan, that what is my station about. At least a couple of things that you must think about is that what should I actually take inside with me? What information do I need to take inside? Okay. Now, that information should be that which department you are in, for example, um, what is the age of the patient, what is the presenting complaint, and according to that presenting complaint, just try and narrow down the differentials in your head already. Okay, because while you're talking to the patient inside the cubicle, you're not going to have enough time. Now, when I conduct mocks and I see doctors, because you can't see yourself while you're practicing, I can see you when I'm conducting the mock, and I can see that what impression it puts on me when a doctor is doing like this. Well, it doesn't leave a good impression. And the same, like, you don't sound very confident, you don't look very confident. And trust me, in Plab 2, your success is very much connected to how you present yourself, how confident you look. Okay, it's not all about that how much knowledge you have. All right, so that thinking, you have to narrow down that thinking period by all means. For example, by having a very flawless practice while you are preparing now. So practicing a lot. And also another trick I told you, standing outside the cubicle, narrowing down your differentials. That for this presenting complaint, for example, I'm going to have these differentials. Okay. Now, during the course, I help my doctors by to remember their differentials in different techniques. So we use different techniques, different mnemonics, so that, for example, if we have picked up one particular symptom of chest pain or shortness of breath or cough or headache, we use certain mnemonics to so that in the exam you can just remember that mnemonic and you can narrow down your differentials. That's another trick of not losing much of time in your exam. Okay, so while I'm just beginning from that point that you just saw, you were standing outside the cubicle, you saw this 21-year-old gentleman, a young patient who's coming with a lump in the groin region. Okay, now it's a lump, it's in groin region. Okay, so now you will start thinking, while you're outside, you will start thinking of your differentials. What can be differentials if I found a lump down there? Okay, so first of all, ask the patient, does the lump disappear or not? If the patient says that with the stress or with the pressure, with cough, the lump does change, then it's probably not lymphadenopathy. Okay, it could be hernia, it could be a cyst, it could be anything else. Okay, but it is not lymph nodes then. All right, so thinking about your differentials while you're still outside the cubicle, I want you to think about these things, but not all of them. Not all of them. I don't want you to ask questions about all of these, or I'm not asking you that you have to rule out all of these when you go inside the cubicle. Okay. However, you should have a mind map. You should have a mind map of roughly some differentials. Okay. Now, I'm going to tell you another technique, doctors. For differentials, if you ask me, well, Dr. Asia, you're saying that I shouldn't have 6 differentials to be ruled out in my Plab exam. Then how many differentials I should have? Maximum of 4 and minimum of 3. Okay, so between 3 to 4 differentials you should rule out. Okay, now if you ask me that, Dr. Asia, what should be actually my priority of having something that this is something that I must not miss in a differential of any condition, any red flags for that particular condition. Okay, for example, I'm sure all of you are very talented doctors. You're working in your countries. If some of you are even not working, I'm sure from your medical school, at least you can remember that if someone came with shortness of breath, for example, what is there that you don't want to miss? For a shortness of breath, you don't want to miss MI, you don't want to miss PE. Doctors, please keep yourself muted. So just like that, every condition, every symptom will have its red flags. Doctors, please, can I request you to keep yourself muted? And Dr. Farzana, Yasmin, can you please keep yourself muted? If you have any questions, you can ask at the end of this session. All right. So doctors, as we have decided, we'll have 3 to 4 differentials. And out of those, your priority should be the most serious ones first. Okay. Something that can make someone die. Okay. For example, any back pain patient comes to you, your first priority should be to rule out quara equina. Your first priority should be to rule out any secondaries, any metastasis. So cancer signs, red flags. Okay. So one thing we have decided that we'll ask most serious ones should be our priority in our differentials. Okay. So one thing we have decided that red flags will not miss, and we'll have 3 to 4 differentials, not 6 differentials. Okay. But while you're mind mapping, you may not remember all of these. You may not remember all of these, but at least some of this. Okay. All right, doctors. Moving on to next slide. So now you are entering the cubicle. You have entered the cubicle. All right. And you have started talking to John. Okay. Excuse me. So you have started talking to Mr. John, and after the introduction, I'm sure that in many of my YouTube videos as well, in my previous sessions as well, I have told you that how to conduct an introduction, how to put a good impression, good first impression on your examiner, so that they know that, this doctor is going to do well. Okay. So first impression is very, very important. Practice your introductions. There are certain different types of introductions that you must practice. Now, when you start preparing for your exam, this should be your first milestone to be achieved. Start practicing with yourself, the introduction itself. You're going to think, well, this woman is crazy. She's telling me to practice. Hello, Mr. John. How are you doing today? Hello, Mr. John. My name is Asya. I'm one of the doctors working in emergency department today. How are you doing? So you're saying that, Dr. Asya, you're crazy. You're asking us to practice this. Trust me, English, many of us, English is not our first language. And then we just think that these 2 to 3 lines are just so easy to say. But when you go inside the cubicle, you'll be so lost. And if you have not practiced this, it's not going to leave a good impression. So practice this. This should be your first thing. This is something that you should make it as a part of your personality. Now, I have been working in emergency department for one and a half year now. So for me, it's by now it's part of my personality, that, talking like that every day. But you should practice that. Okay. Anyways, so you entered the cubicle, you introduced to the patient, and you started asking John, how can I help you today? How may I help you today? Now, John said, doctor, I've presented because I have a lump in my groin area. Now, what are you going to do is you are going to explore. You're going to explore that presenting complaint. Okay. So exploring that presenting complaint in terms of disc P. Okay. So how do we explore lumps? All right. So we're going to explore lump. Doctors, I'm not teaching you history taking today, because obviously that's a very, very first lecture. That is an introductory lecture in our course. So I would assume many of you must have attended some academies or must be attending some courses. However, if you're interested to take my course, you're more than welcome. But yeah, that's we explore the presenting complaint in terms of OD para, or what you call it, Socrates, if it is pain. But obviously we don't have pain here. We don't have any other presenting complaint. At the moment, we are dealing with a lump. So while you are dealing with the lump, how do I explore if it is a lump? How do I ask some more questions to the patient, from the patient? Okay. So the questions would be a mnemonic for you to remember, disc P. Excuse me. So you'll be asking about discharge. Okay. Discharge. You'll be asking about, is there any itchiness around this lump? Okay. What is the size of this lump? What is the shape of this lump? What is the color of this lump? Okay. So size, shape, S for size, S for shape, C for color. Okay. So, and also asking the patient whether this lump is unilateral or bilateral. Okay. If it is it just present on one side or other side? What is the number? Okay. Is there only one lump or there are several lumps? Or you can just ask the patient, please tell me more about this lump. Now, what's going to happen? Now, that question I call as a golden question in your consultation. When you ask, tell me more about your lump, he's going to tell you a little bit about his lump, and he's also going to tell you some associated symptoms, which is going to reduce your effort of asking separate questions. Okay. And when you don't have to ask too many questions, what is going to happen is that you're actually saving up on your time as well. You're saving a lot of your time. Okay. All right, doctors. So we have asked the patient about the lump. Now, what are we going to do is that we are going to ask him any associated symptoms. John, do you have any other symptoms at all? Now, John will obviously tell you if he has any other symptoms, but if he's not opening up, now you will ask other symptoms. Okay. You'll ask the other symptoms as we decided. We'll ask at least 2 to 3 differentials will rule out. So you'll rule out the red flags. Okay. You'll ask about flaws, fever. Now, lumps and bumps, he's already presenting with lumps and bumps. You'll ask about his appetite, his any weight changes, and you'll ask about night sweats. Okay. So you've asked him about the red flags as well. All right. Now, doctors, if ever while you are ruling out any differentials in any stations, when you can't remember anything, at least 2 questions you should always remember. One is fever, the other one is trauma or injury. Okay. Did you hurt yourself at all? Okay. Now, doctors, during my course as well, I tell doctors that I realized when I was preparing myself for Plab 2 exam, one thing that I realized that Plab 2 is not about whether you know which questions to ask, because the time is our biggest enemy in this exam. The question is whether you can ask these questions by saving your time. So short forms of asking questions. For example, if you've said you can just, when you start ruling out the differentials, you can just signpost and tell the patient, John, now I'm going to ask you some questions. Now, this can be quite overwhelming for you, but the answers can be just in yes and no. So please bear with me. Now, you're just going to keep on asking him, do you have any pain or burning while passing urine? No, doctor. What about any discharge through your private parts? No, doctor. Any fever? No, doctor. Any tummy pain? No, doctor. Any nausea, vomiting? No, doctor. Any change in your appetite? No, doctor. So did you see how quickly I'm asking those questions? And I've also signposted, I'm not just throwing these questions onto my patient's face. And he's just wondering, this patient, this doctor is just overwhelming me, or is these questions are just, there's a full range of questions and he's just very intimidating. No, because you have signposted already that I'm going to ask you some questions. The answers can be in yes or no, but please bear with me. Okay. So it's going to be all right when you ask these questions. So we're not going to ask more than this, doctors. Okay. By this, you've asked him whether it could be UTI. You've asked him, could it be cancer? Okay. And you've also asked him, could it be STI? Okay. So we have only asked the important questions, important differentials. All right. Okay, doctors. Moving on to next slide. So we asked about the presenting complaint. We have explored it. We've asked the patient open question at the very beginning so that it reduces our effort of asking individual questions. And we can just pick and choose now that which questions patient has not mentioned himself, what information he's not given himself. Okay. Now, the important part of history. Now, this comes usually in personal history. Okay. So after your structure would be presenting complaint, you've explored the lump, you've asked the associated symptoms. Now you will ask about P1 and P2. I'm sure you know what P2 is. P2 is actually a past history of your presenting complaint. So John, have you ever had this kind of lump in the past? Okay. John, have you ever had this kind of lump in the past? And then P2B would be past medical history. Okay. So, John, do you suffer from any other medical conditions? After you've taken history, okay? So sexual history and travel history in all stations. If you are conditions, long-term cancer, or if you're suspecting any sexually transmitted infections, okay, like hepatitis, things like that, okay. So the travel history, the transfusion history, the tattoos history, the drugs history, the sexual history, you're going to ask in those kind of stations. Another tip, I am not being racist, I'm not being judgmental, but also they try and put simulators in these kind of OSCE stations who are full of tattoos, who have many piercings. Okay, so that should be another hint for you. Okay, whether I should take sexual history, tattoos, or recreational drugs history from this patient or not. Okay, but please do think of those things which I have told you: hepatitis, TB, sexually transmitted infections. Because patient will give us some clue in terms of dysuria and discharge from his private parts. That's why now we must take the sexual history. Okay, we must take the sexual history. Now, sexual history, doctors, many doctors I see during the mocks that they do couple of things. One thing is that very common, especially in subcontinent, that doctors, they do not kind of have an eye contact when they are taking sexual history. Doctors, we are doctors, and we should be confident when we are taking sexual history, and it's going to put a very bad impression on the patient, on your, and it is actually in the UK, it is considered very offensive when you don't look into patient's eye, or don't look too much that it starts seeming intimidating. Doctors, can everybody hear me? One of the doctor can't hear. If they can't hear only, then it could be a problem with their side. But if I'm just wondering if others can hear me. Oh, lovely. Okay, thank you so much for confirming, doctor. Okay, great. Okay, doctor. So first thing first, for your IPS point of view, from the IPS point of view, please make sure that you are not being judgmental from your tone, from your body language, and also make the eye contact. Okay, don't be nervous, please, when you're taking the sexual history. The second thing is that please don't start taking sexual history just randomly. Okay, always signpost first. Okay, the questions that I'm going to ask may sound a bit intrusive. Okay, if you want to use easier language, please, doctors, I want to, from the IPS point of view, I want to mention to you, doctors, if English is not your first language and you are not very comfortable with this, please don't try and use very fancy words which seem like very artificial to you, and they seem like they don't belong to you. Please be comfortable. Be comfortable in your shoes. All right? That's what is going to put a good impression. It is not an English exam. It's not a language exam at all. Okay? So try and use easy language. Okay? So the signposting I was talking about, don't just randomly start asking sexual history. Signpost first. John, I'm going to ask you questions which may sound a bit uncomfortable. So now I'm not saying intrusive, I'm saying a bit uncomfortable. Okay? So, or you can say the questions that I'm going to ask may sound a bit too personal. At any point, if you're uncomfortable, you can stop me. Okay? Are you sexually active? So please ask, this question should be your first question. Are you sexually active? Don't ask, how many partners have you got? No, please. If you have not asked somebody, imagine someone is sitting in front of you who is not even actually sexually active, and you're going to offend them, and you'll fail the station straight away. If you have not asked that if they are sexually active, before asking that how many partners they have, or how many, sometimes, for example, randomly doctors ask, are you pregnant? Without asking the lady if that poor lady is even sexually active. Okay, so please ask, this should be your first question. Are you sexually active? Do you practice safe sex? Okay, do you have a stable partner? If the patient does say that they have a stable partner, then it takes away the question of, do you have multiple partners? Okay, if they say that I don't have stable partner, then you can ask, do you have multiple partners? If they say I do have stable partner, the question about other partners you should ask, do you have any other casual partners? Okay, do you have any other casual partners? Okay, have you noticed the similar symptoms? Like if the patient has given you, has come with lymphadenopathy in inguinal region, he says that he has dysuria, he says that he does have discharge, then have you, are you aware, or if you're, has your partner mentioned to you that they have similar kind of symptoms? Okay, by any chance, do you know if your partner has similar symptoms? Okay, so we are done with the sexual history. Do ask about very short travel history. Have you traveled anywhere recently? And if they have traveled anywhere else, do ask them, because it is very, very relevant. Okay, do ask them if they had unprotected sexual intercourse over there. Okay, it might be actually positive for this station. Okay, all right, doctors, as I said, doctors, don't ask about tattoos, transfusions, and recreational drugs everywhere. Again, for recreational drugs, please, if a 60-year-old gentleman, I see a lot of this, that where a lung cancer patient is sitting in front of you. Now, this gentleman is about 73-year-old, very unlikely, doctors, here in the UK, elderly population doing IV drugs. Okay, very unlikely. Excuse me. So be mindful of these things. Don't offend people where you are not suspecting anything of that sort and you're asking about IV drugs and tattoos. Now, it is completely relevant in this station. Okay, as I've told you, if you're suspecting STIs like HIV, syphilis, if you're suspecting things like TB, things like hepatitis B, C, do ask about tattoos and IV drugs. Okay, now you will signpost before that as well. I'm sure many of you, most of you know that we signpost before IV drugs as well. If any of you doesn't know how to signpost for this, do let me know. I will tell you about that as well. Now, drinking, a quick question. It is not very, very relevant. You can just quickly ask, do you drink alcohol at all? Okay. All right, doctors. Now, our history completes there. Okay. After the history, I'm sure all of you are aware that we thank the patient and we ask them just another kind of question which will summarize everything, and that will decrease your chances of missing out on any important information. Now, we miss out important information sometimes, and then what happens is that we miss the diagnosis. Okay, now this will be your last chance. You took the opportunity and you asked the first golden question to the patient at the beginning of your station. Tell me more about it. Now, this is your last chance of asking this very, very, very lucrative station question, which is excuse me, Have I missed anything at all? Okay. Thank you so much, Mr. Albert. And sorry, I've been overwhelming you all this time. Um, have I missed anything at all which you would like to add? Okay. And this is your opportunity where you can ask, where you can do ICE as well, where you ask, explore patient ideas. You can explore their concerns and their expectations. Now, concerns are something that are not to be missed. That's another tip for you, that in Plab 2 exam, if you missed concerns, if you don't deal with concerns many a times, you fail. Okay, so addressing concerns is very, very important. All right, doctors. Um, Ideas, I like to ask that question of ideas before I tell the provisional diagnosis to my patient. Okay, because it makes complete sense. I'll tell you in a minute why it makes more sense to put the ideas questions before we tell the provisional diagnosis to the patient. Okay, at this point we have summarized, we have taken the history from the patient. See, doctors, did you realize that I have not taken a very, very long history? I'm sure I have not covered the proper structure, which obviously I cover in my course. I teach you that very first day, the proper history structure using mnemonics and things like that. But I have not covered that all. I'm assuming that many of you are already aware of that kind of structure. So we have today, my intention of doing this station is that so that I tell you that what does a focused history means when you have stations like these where doctors always struggle to finish. What does a focused history look like? What does it consist of? Okay, so I will be summarizing at the end again. What did we do in the history? um, Now, examination part, doctors. Now, you will verbalize the examination. You will tell the patient that I would like to examine you now. I will start by checking your observations. Doctors, here at this point, some doctors wait for the permission. Think that, oh, I'm just asking the patient, well, can I examine you now? Or I will like to examine you now. And they wait for the patient to respond. Please don't. You just continue saying this, okay? Now, I would like to examine you, if that's okay. I will start by checking your observations, which includes your blood pressure, your temperature, your heart rate, and your oxygen saturation levels. I will also be performing a head-to-toe examination, just looking for any lumps and bumps anywhere else in your body. And at this point, the examiner may give you the finding of there is generalized lymphadenopathy. Now, patient has a generalized lymphadenopathy. Now you are connecting the dots and you're realizing patient has generalized lymphadenopathy, patient has some red flag signs, patient has discharge, and patient has probably, they might give you symptom of weight loss or maybe fevers. And now you're thinking about in terms of STI. Okay. All right, doctors. So, doctors, another thing I would like to mention here, which I see many doctors making a mistake, they tell the provisional diagnosis to the patient, and then they end up not telling the patient that whether they are going home, is it a very manageable condition? Is it a treatable condition? Or they forget to tell the patient that I'm not sure what it is right now. It is okay to say that, doctors. If you don't know, be honest. Okay? Be honest. Yes, in order to pass in Plab 2 exam, it is very, very important that you have one single provisional diagnosis. Okay? But it is okay to say, even at the end of that before I confirm this, that what you have, we need some further. We are, in the end of the day, even if you're a GP or a junior doctor in ED, for example, you'll still not always know right there, right then and there, that what does the patient has. So I tell doctors that during your Plab exam, one thing that you should not forget is that in the end of the day, you are a doctor. Forget all those scripts that you learned. You're allowed to do so. But please don't forget one thing, which is you are a doctor in the end of the day. Okay? So if you don't know, just tell the patient what you know. And not knowing anything at all is also bad. If you say, well, I don't know exactly what it is. No, you should have one provisional diagnosis and you should say, now I'm afraid. Now let me say this, okay? Let me say this from the beginning. Well, John, when I connect the dots of what you have told me, and after examining you, now I'm afraid I could find more lumps and bumps around your body as well. Okay. Now, it can be a sign of several things. Okay. Now, worst case scenario, best case scenario, it can be any sexually transmitted infection like gonorrhea, syphilis, or it can be something more serious. Okay. And when I say more serious, I'm saying HIV, I'm afraid. Okay. But I want to reassure, if the patient's expressions change, please don't forget to acknowledge, because that's part of your IPS, acknowledging the non-verbal cues, acknowledging the body language. Okay. Acknowledge their body language at this point and say, I can see you're a bit taken aback. My intention is not to scare you. Okay. I must say, John, that I am not sure as yet what it is. We still need to do further tests, okay, to confirm what it is, whether it is a sexually transmitted infection or one of those infections can be HIV as well, I'm afraid. Okay. So we will be conducting some more tests. We'll do some blood tests, including blah, 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 where you will be saying all the screening, obviously. You will also be mentioning about the swabs because he has discharge. And you will also be mentioning about what you call it, HIV testing. Okay. Now, John, now, whenever a patient comes to you with STI, you always offer them HIV testing. Now, you say usually that, John, whenever patients come with these kind of symptoms, we tend to offer them what? We tend to offer them HIV testing. Would you like to have one? Okay. But in this case, because it is highly likely that he might be HIV positive, your suspicion is high. So you're not going to say, would you like to have one? You are still asking him, you're taking the consent, but in a different tone. Now that different tone will be, John, whenever patients come to us with similar symptoms as yours, we tend to offer them a HIV testing. And in your case, I would highly recommend to have one. So did you see how I said, would you like to have one when it is other STIs? But when I am suspecting HIV, I'm telling the patient, I highly recommend. I'm saying to my patient, I highly recommend that you have one. All right, doctors, sorry. I'm just recovering from COVID. I've just tested negative today, so a bit of a sore throat still. Okay, doctors, I'm sorry about this. Anyways, okay, doctors. Who is this? Please mute yourself, Dr. Charles, Dr. OCD. All right. So please don't forget to mention to patient that you don't wish to alarm them. You don't wish to scare them. Okay. You're just trying to rule out everything. Okay. Okay. So that I'm not missing anything. John, my intention is so that I don't miss anything. So that's why we are doing all these tests. Okay. Right. Why I wrote IPS? That's from IPS point of view, because if you are that doctor who will just say to the patient, well, you might also have HIV, and you don't say anything else, you're just scaring the patient. You don't know, you're not even sure yet that patient has HIV, but you just said to them, and just imagine yourself. I tell my doctors always that always put yourself in patient's shoes and imagine someone told you the same thing. How would you react? Okay. Okay, doctors, coming on to our management plan. So, doctors, after you've told the provisional diagnosis to the patient, tell the patient that whether they need admission, whether they have a chronic condition, whether they have an acute condition, they need to come in, they need to go home. Okay. So, at this point, you mention to your patient, okay, wow, John, for this condition, the good news is that you can go home. You don't need to come in to hospital today, so I'll be able to discharge you at the end of our consultation. um, do tell them once the bloods are back, once the swab results are back, we'll follow up with you. You can also refer him to gum clinic, okay, genitourinary medicine. You can refer him that there. You can mention to him that how about John, if from today we make a plan to see you again in 2 weeks time, okay, and if he has red flags like weight loss and things like that, make a 2-week referral pathway, okay, so refer him to the specialist, um 2-week referral pathway, all right. But if he doesn't have any red flags, it's just that he has lymphadenopathy and he has discharge, just do the swabs and tell him that, once your swab results are back, if we see anything worrying, we'll be contacting you ourselves. Otherwise, how about we make a follow-up plan for you to see you in 2 weeks time to check on you, how you doing. How does that sound to you? That sound perfect, doctor. Okay. So you've made follow-up plan. You have told the patient whether he's coming in or going home. You told him that once the investigation results are back, you'll be contacting him. Okay. And now you will safety net. I tell all the time, doctors, that another key of your success in Plab 2 exam is this, especially in your patients who are going home. Please don't forget to safety net the patients who are going home. Okay. So who can see what you share here? What do you mean? Are you not able to see it, doctors? Okay, so you will be safety netting your patient now. Tell him to have, obviously he has given you a positive history that he does not practice safe sex. He has multiple partners. So tell him that to practice safe sex. Tell him that we have to inform your partners and ask them to get tested as well. If the patient has a question and says to you, doctor, what if I'm HIV positive and I don't want to tell my partner? Okay. What does he say that? Try and convince him that I'm sure the little chat that we had, you sound a very reasonable person. And I'm sure that you care about your loved ones. They can spread it to others. Okay. And it's important that they know about it. Okay. We can let them know anonymously. However, we will abide by the rule, by the law. And the law says that if it is HIV, we cannot disclose it to anybody. Okay. It's about your confidentiality. If at all, in worst case scenario, you become HIV or you are HIV positive, we will not disclose it to anybody. That's the law, doctors. Okay. Now, mention to him about the red flags, that anytime his symptoms start getting worse, he has any weight loss, night sweats, starts having any diarrhea, any unusual rashes on his body, or his symptoms get worse, he needs to tell you right away. Okay. Don't tell doctors, please. It is another important thing that in Plab 2 exam, you should know when patient should call the ambulance. Okay. For example, if you were doing the back pain station and someone develops, you're telling someone if they develop cauda equina. In that case, what should you tell the patient? That inform your GP or call the ambulance? What would you do, doctors? Inform your GP or call the ambulance?
Call the ambulance.
Wonderful, doctor. Well done. Another scenario where your patient developed some side effects from the medication. What should they do? I'm not talking about anaphylaxis. I'm talking about tummy ache, diarrhea, sickness, dizziness. Call the ambulance or call the GP?
GP, of course, it is a less serious symptoms.
Amazing, doctors. So please, this common sense that you all have, please use it in Plab 2 exam as well. So do safety netting appropriately. Know your limits, what your limits are in NHS. Trust me that if you start taking this exam in a way that this is going to make my job easier for me, adjusting into NHS, that too during COVID times, is not very easy. So when you land here, trust me, this exam is actually going to make your life easier if you have done it in a proper way. If you've known the laws and the system and the organizations and what is important here, what is not, it will only make your adjustment very, very easy. Trust me, that's how I found it. I knew things well, and it really helped me to gel in very quickly. And also less of an embarrassment. Okay. What if you were working, you land up in A&E like me, and that's your first job? What's going to happen if you don't know much? Okay. So learn it now, and learn it not only with the intention that you're going into the exam, also with the intention that tomorrow you have to treat real patients. What if you're in A&E and you actually don't know that, at times patients will come with complaints that you have no idea about? How will you deal with that? You will end up dealing with that as well. Don't worry. So the similar way, now doctors who worry about Plab 2 news stations, I always tell them that if you learn the techniques, if you learn in a systematic way, it will not be a problem for you. Even the news stations will not be a problem for you. And many of my doctors who have attended my course, they end up doing well in news stations as well, because I teach you technique. I don't make you robots. Okay. Okay, doctors. Just a bit of a summary. And then if you want to know about the course, please do let me know. I have a recorded course as well, which has a very high passing rate. And I also am planning to conduct a live session as well, a live course as well in end of February or March. Now you will have access to the recorded course at the same time, live lectures. So you'll have a double benefit, and first 20 doctors will get a special discount. So do let me know if you would like to enroll or show your interest at this point, so that I can start enrolling you guys. Right. Okay, doctors. So summarizing today's session. So as I said, I know most of you know the history structure. Most of you know how to deal with the lymphadenopathy station or a suspected HIV station. But what I have noticed, that doctors struggle finishing it in time. So my motivation, my intention today was to cover it for you in a way that you can finish it up within the given time, which is 8 minutes. Okay. So you're going to take a focused history. Okay. And you're going to think about outside what my history. So you're going to think about the sexual history and the red flags first of all, that in my history taking, I must not miss these two things. Okay. So you're going to narrow down your differentials to, so you'll begin with presenting complaint. You'll explore the presenting complaint. Now presenting complaint is a little bit different here. It's not nausea, vomiting, or pain. It is a lump. Now I've told you the mnemonic. Okay, I've told you the mnemonic, how to remember to explore the lump. Okay, which was disc P. All right. And then after that, you'll ask about associated symptoms. You'll ask about 3 important differentials, and then you will come on to past medical history. After that, you'll ask about personal history, which will also include sexual history, drugs history. And then you will ask patients' concerns and expectations. Then you will tell the provisional diagnosis. Sorry, I've missed the examination after the history. So examination, provisional diagnosis, important bit, telling the patient whether they are coming in, they're going home, whether their condition is treatable, and what will be your plan from here onwards. Okay, you're doing some investigations, some swabs, you're sending the patient home, you're arranging a follow-up. Okay, and you're telling them about the specialist clinic. All right. And then important part, safety netting, partner notification. If they are using drug, telling them about the needle exchange program. All right, that would include in your safety netting. All right, any questions, doctors? Yes, doctor. Doctor, something is wrong with your mic.
The lump explode
Hello.
then. Yeah, hello, can you hear me?
Yes, I can hear you, doctor.
Can you? Yeah, you said lump explode, DISSCP. What's the meaning?
What is the meaning? So
Yeah,
it's the mnemonic for this everything here. Okay, so discharge,
okay.
I for
Discharge.
itching, size, then another S for shape, color, and pain, P for pain. Is the lump painful at all?
Okay, 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 okay. This is how we crack the lump.
Yeah, this is how you would explore the lump.
Lump,
Dr.
okay.
Asier, can I ask you
Yes.
the question? Assalamu alaikum.
Walaikum
Yes,
salam.
yes. If patient mentioned that if they are using IV drugs user and they are just using the needle, so needle aging programming, should we say in that point, or if not, we have to say it at the end at the safety netting? What would you suggest?
You can, well, my personal advice to you would be, for smoking and needle exchange program, try and counsel the patient then and there. Okay, because don't
Okay.
wait for the management, you'll always miss it.
I see. Okay.
And this
So we
is
have to
your,
just. Mhm.
these bits are, sorry to cut you, but these bits are the ones which are additional points, which are just bonus points for you to pass Plab 2 exam.
Okay, yeah. So we have to just say that there and there, like we do have a program. If you're using needle, do you share the needle? Ask the question and tell us straight away, and then move on. Okay, then.
Exactly.
Yeah. Thank you.
You're very welcome, doctor. Okay. Any other questions, doctor? Okay, seems like everyone is happy and there are no more questions.
Hello, doctor.
Yes, doctor.
Yes, I wanted to ask if, as in this case, we are suspecting it to be an STD. So why don't we just refer to a gum clinic from the starting itself? Because the gum clinic gives faster results, right? The swab and testing results.
Well, it's not faster. What it does is that patient does not need to have appointments. So it's kind of a walk-in service for any STDs or STIs. it totally makes sense. Yes, definitely. Anytime a patient you're suspecting STI, you can refer them straight to gum clinic, because then it will save them all the time for waiting for the appointments and things like that, and it is a walk-in service.
So
Okay.
in this case, we can do the same thing, right, doctor?
You can
We can
You
just
can.
refer to gum clinic.
refer
Okay.
to gum clinic, but don't leave the patient alone and say that, because this is something serious involved in it. Okay, so don't, if it is any other STI, you can say to the patient that then you will be followed up in gum clinic. However, if the patient, you will also say to the patient that I will also keep an eye on your test results and your swab results, and if there are any concerns, I will be contacting you, or one of my colleague will be contacting you.
Okay, doctor. Thank you.
You're very welcome, doctor. Any other questions? Okay, everyone is happy.
Hello.
Okay. Yes, Dr. Mahesh wants to know about the course.
Hello, doctor.
Yes, doctor.
Can you please repeat, like, when are we going to refer the patient to the gum clinic? And otherwise, if you're not referring to the gum clinic, where are we going to refer the patient? The patient is coming with STI.
Any patient any patient coming with STI, yes, you refer them to gum clinic. Okay. In this case, you can refer the patient to gum clinic. Definitely, that's where you're going to refer them. But what I'm trying to say is that you can say to the patient that we'll be referring you to gum clinic, but at the same time, just don't leave the patient alone, and don't say to them that, I'm just going to leave you alone. Okay. From here onwards, you will be followed up in gum clinic. No, you will keep, because here you're suspecting something serious, and a multidisciplinary team is usually involved. If at all it is a HIV condition, so patient will be under the infectious disease department. Okay, so then the thing will be different if it is a HIV patient. Okay.
All right.
All right, doctors. Seems like everyone is happy. One of the doctors asked about the course. Doctor, what are your Dr. Zohra, please, can you mute yourself if you don't have a question? Okay. So one of the doctors asked about the course. I will repeat about the course, but do get in touch if you have, no, that's fine, doctor, don't worry. If you have any specific concerns or questions that you want to know about the course. Now, as I said that I run a recorded course already, which has very, very high passing scores. To date, there are hardly any doctors who have failed. I can say about 97, 98% results. So the recorded course is a 17-day course. Okay. It covers about 150 to 180 stations altogether. So I teach you the patterns and then I go through the specific stations. However, I'm also planning, if enough doctors are interested, I'm planning to conduct, because I work as well in the NHS. So I will only arrange if I have enough people interested. So that course will be about 2 to 3 days of live lecture, okay, in a week, where obviously I will take that approach, a different approach I'm planning to take, where I will teach you and I will also practice with you, which will be kind of a group mock kind of approach. So I will assess you guys at the same time, that how you're doing and how you're improving. And then during the week, we'll again you will have access to my recorded course. And then you'll come back, we'll have another live session of maybe 2 or 3 days in a week again. And then we will do the live lecture where I'll teach you and then go through some new stations with you, and have kind of discussion and mock session where I will be giving you some scenarios, practicing with you doctors. So we'll take that approach. It is going to be, I'm sure it's going to be very lucrative. It's an approach that I'm taking a bit different than any other academies or any online courses, because I have just realized that this is how, because doctors who come to me and I conduct mocks and I know that most of them pass with the feedback. So I'm just trying to kind of give my feedback as well on your performance and on your practice, and trying to kind of inculcate into my course. Also the live session, obviously, doctors who attend my recorded course, they are always in touch with me. I've not used any apps or any websites. I do have my website, but I have not made it functional just because of that reason, so that I personally stay in touch with my doctors, and I can answer their queries, and I do answer their queries through voice notes and things like that. So even if anybody is attending a recorded course of mine, it's not like other academies. They still are in touch and they can ask me questions anytime. Obviously, when I'm at work, my ED shift is around 10-11 hour long shift, with an added 1 hour of drive. So when I'm on my shift, obviously, it can be a delay in answering question, but I always come back to them. Okay, doctors. So anyone else has any questions before I leave? Please let your friends know about the course. And they are more than welcome to join the group as well. The group link I have shared here as well in the chat box. Feel free to, and also in the group, when you attend the group, do let me know that any future free sessions you guys would you want me to conduct, any free sessions on any particular topic. I would like to hear, and also let me know if today's session was any useful. I like to hear your feedback, so do leave your feedback in the group, in Telegram group. All right, doctors, and let your friends know about it. Okay, that's it. Okay, doctors, take care then. Have a lovely evening. Bye.
Thank you.
You're very welcome, doctor.
Thank you very much, Dr. Asia.
You're very welcome.
Thank you, Dr. Asia.
Very
Dr.
welcome.
Asia,
Lovely to have you all.
can you show us
I
the
missed
first
your,
page? The
sorry,
first
Dr.
page
Asia, I
again.
missed your,
The first page. No. Okay, yeah.
the message, and would it be on YouTube? You are going to put
This
on the,
lecture?
yeah, this one.
Not straight away. As soon as I get time, because I'm starting. I'm going to work tomorrow, so as soon as I can,
But
I'll
can
try
you?
to put it on you.
Okay, but can you share it individually if I ask you on
No.
what? No. Okay, that's fine. Okay, thank you so much. I appreciate that.
You're very
Okay,
welcome.
Dr. Asia,
Yes.
I just want to ask, in these differentials you've just given, I mean, I followed the lecture through. There is nothing, no malignancy, no cancer in this differential. So in the exam, if you put one up as one of your differentials, what happens? I mean, maybe a lymphoma or a leukemia could have multiple lymph nodes, you know.
Yeah. So I did say, sorry, it's not in this list because I thought that is like an integral part of my history structure always. So I always tell my doctors that never miss those red flags until or unless someone really comes with like a sore throat and, kind of, and very, very mild presenting complaint, then anyone coming with presenting complaint lasting for, they've been unwell for a while, and as a doctor you would know, oh well, I must ask these questions. So I think that's the reason why I haven't put it in. And HIV, I thought if HIV is there, you're going to ask those questions anyway.
Okay, thank you very much.
You are welcome. Okay, doctors, take care.
Thank you. Bye-bye.
Bye.